American taxpayers should not have to foot the bill for ideologically driven experiments on our nation's youth, and hospitals that we deem must meet the minimum quality standards of care and safety should not be conducting these experiments when we know so little about what is happening with our youth. Now the important part. For these reasons, and I can go on and on, this document, the white paper that Secretary commissions over 300 pages long, we are taking major steps at CMS to stop a funding process that has led to irreversible medical interventions with two major actions. The first, we're announcing a notice of proposed rulemaking that ends taxpayer funding of sex-rejecting procedures for children in Medicaid and CHIP, full stop. We don't provide health care to every child, but at 53%, we've got most, and we're not going to let taxpayer money go to hurt these children, and those children will no longer be hurt with this ideology.
A definitive shift, a promise kept. Dr. Mehmet Oz has declared a full stop on the federal funding of irreversible procedures for children. The era of state-sponsored ideology ends now. Standing before the seal of the Department of Health and Human Services, Dr. Mehmet Oz delivered a message that resonated across the heartland. It was a moment many Americans had prayed for, a return to medical sanity. The newly confirmed CMS Administrator did not mince words as he addressed the nation regarding the use of taxpayer dollars for what he described as permanent and life-altering medical interventions for minors. Oz framed the new policy as a restoration of the Hippocratic Oath, to do no harm. He announced a proposed rulemaking process that would effectively prohibit Medicaid and CHIP from reimbursing any sex-rejecting procedures for those under 18. This isn't just a policy shift, it is a moral declaration. For years, the previous administration expanded access to these experimental treatments, often leaving parents and taxpayers feeling powerless. Now, the Trump administration is using the full weight of the federal government to protect the most vulnerable, ensuring that the Treasury is no longer a piggy bank for controversial social experiments. The core of this decision lies in a simple traditionalist principle: the protection of childhood innocence and the preservation of biological reality. Dr. Oz highlighted the grave ethical violations inherent in subjecting children to irreversible procedures before they have reached the age of informed consent. He spoke of the permanent changes these treatments cause and the systemic failure of a medical establishment that has prioritized ideology over clinical evidence. By cutting off the flow of federal money, the administration is sending a clear signal to hospitals and clinics nationwide that the practice of medical transition for minors will no longer be subsidized by the American worker. Critics call this an attack, but the administration views it as a necessary defense, a way to neutralize the influence of radical gender theory in our healthcare system. The fallout is expected to be intense, with legal challenges already looming. Yet the resolve in Washington appears unshakable as they move to dismantle the infrastructure that supported these procedures for years. The reaction from the public was swift and polarized, but for the silent majority, it felt like a heavy burden had finally been lifted. On social media, supporters celebrated the news as a major victory for parental rights and child safety. Many observers noted that if a citizen is not old enough to purchase alcohol, they certainly should not be undergoing life-altering surgical operations. This move is the culmination of a campaign promise made by President Trump to stop the conditioning of youth through state-funded medical channels. However, the opposition is preparing for a long struggle, labeling the move a setback for civil rights. Advocates for these procedures claim they are evidence-based, yet the administration points to the growing number of individuals who regret these permanent changes as proof that caution is the only ethical path forward. As the rulemaking process begins, the eyes of the nation are on Dr. Oz, who has transformed from a television personality into a key architect of the traditionalist restoration, standing firm against intense opposition. The United States is not alone in this pivot toward caution. Several European nations have already begun to roll back their support for pediatric medical transitions, citing a lack of long-term evidence regarding safety and efficacy. Dr. Oz's announcement brings America in line with a growing international consensus that the rush to medicalize childhood distress was a tragic mistake. This systemic failure within the medical community is now being corrected through firm executive action. The administration's strategy is clear. Use the power of the purse to enforce a standard of care that respects biological reality and protects the physical integrity of the next generation. This isn't just about healthcare. It's about the soul of the country and the kind of future we are building for our children. The full stop declared by Dr. Oz is a line in the sand, marking the end of one era and the beginning of another, where common sense and traditional values once again lead the way in our nation's capital.